SYRINJA injectables.
Yep. And I call her a ninja.
Syringe ninja. It's
Syringe
just two words
ninja.
together. Checking for symmetry. We're measuring things. Like we're busting out rulers. Major nerves and arteries are right along. I was all excited starting my journey. Like, I'm going to be a doctor. And then that happened.
It's just, if it keeps happening, word may spread.
Exactly.
And then there goes the reputation. Welcome back to Get the Fix podcast. Today I'm joined by our ninja, Sab. Tell us more about you. What brings you into this industry? What do you do? What are you known for?
I came into this industry kind of having no idea about Botox or filler or any of it. And I was lucky enough to train with an amazing facility under a plastic surgeon. And I learned everything that I could possibly imagine and more. And I fell in love with it. And I realized I was actually good at it. But now I'm a specialist in sculpting and body sculpting. So I do non-surgical BBL, which for me and my brand for SYRINJA Injectables is Dream Curve BBL. And we also do hip contour, which is super popular. It's a so technically non-surgical treatment. But you can still get this beautiful, volumizing of your booty area. You can fix those stubborn hip dips, which a lot of us struggle with, especially if we are regulars at the gym, and it's just an anatomical area that just simply doesn't have anything there. It's just very limited. So it's great to put in hyaluronic acid filler, and it just looks beautiful without any downtime.
No downtime.
No downtime.
Just a little Band-Aid.
A little Band-Aid. When the lidocaine wears off, it might feel a little tender, but that's it.
Beautiful. And can you sit on your butt after?
You can. I actually am partnered with New Curves. I don't know if you've heard of her.
I've heard of them.
She's the best. She's actually in Etobicoke as well, but she has these beautiful compression shorts. So it kind of keeps everything nice and lifted and where we want it to settle. So I do recommend my patients after they have the treatment to wear that for about 2 to 3 days. Some of them love it and they end up wearing it even longer, but it's just kind of like nice and shape forming, but it keeps things in place. I do recommend to avoid any kind of glute exercise or glute dominant exercise when they're at the gym. They can do other areas of their body, but just not pumping up the glutes because we want everything to settle in that subcutaneous fat layer.
So your passion, because your before and afters of the booty,
they're
stunning. They're so stunning.
I try.
And have you ever done butt injections on yourself?
I haven't done it on myself. I do my face. I do my own Botox. I do my own laser. I do my own filler.
The AEROLASE, which we have to talk about.
That's just like a magical machine.
But first, where can people find you? Because I know you said Etobicoke.
Yes. Etobicoke is my main location. I have a private studio.
And what is the name?
It's SYRINJA Injectables.
SYRINJA Injectables. Easy to find.
Easy to find. It's on the website.
In terms of the BBL again, what do you find people are mainly looking for? I know you said the hip dips. Is cellulite a big one after a BBL, like surgical BBL?
Yes, because it's not usually addressed after they do the surgery. Sometimes they can get away with when they do the fat grafting. Sometimes they'll ask the surgeon to tighten the skin as well. The biggest, issue I see when it's a patient who's already had a surgery, they've, had the 360 lipo, they've gotten injected there. And, they of course have the surgical scars to show it, right? So they suffer with that. And then on top of that, these adipose cells, they die. Sometimes they essentially are transferred to the area and they just die. There's necrosis that happens and they are just not viable, where there's tons of people that I talk to when I'm doing these consultations and they're like, they've already spent a ton of money doing these surgeries. And we think that a surgery is supposed to be these permanent results where that's actually not true. So I actually do a lot of corrections because, these girls have spent, thousands of dollars. They've traveled all these different places and there's a ton of asymmetry. So at that point, they don't even care about cellulite or the skin texture or anything like that. They just want things to look even. So I see a lot of patients that, left cheek is bigger than the right cheek. Like, please help me. And the surgeon won't touch them now because they've already proven that, the transfer of the fat it doesn't work. Right. So, yes, they can regraft and they can do it again, but sometimes it's a waste of time and money because it might not work again. Right. And it's just something that at least when we know we're injecting a hyaluronic acid and a dermal filler into that area. We know because it is cohesive, it has a high viscosity, it has a high G prime. We know that once we put it there, it stays, right? It's not permanent, but it does have a beautiful duration, 18 to 24 months, which is fantastic.
Yep.
But at least I have a bit of I can give them an assurance and a peace of mind that we're putting in a product that is not going to just die, and it's not just going to magically go away. So we can achieve these beautiful symmetries even post-surgical, or, you know, even if it's just something anatomy wise that, you know, maybe there's some unevenness, but it's so very well received by patients who've already, you know, really hyper focused on this area, and they want it to look beautiful, they want it to look nice and plump, but this is just a much safer, you know, opportunity for them to get that result that they're looking for without having to go spend more money on surgeries.
Okay. Yep. And who is a good candidate and who is a bad candidate for this?
Okay, so a good candidate, I'd say, is somebody who's already has a very active lifestyle, someone who, you know, will be able to take care of themselves afterwards, stay nice and hydrated, you know, preferably someone who's already at a very, you know, good level of health, period, right? You know, most of the girls I see, they're very fit and they have, you know, beautiful bodies. They just want that little extra, because that area is very hard to develop in the gym. As we all know, it's not easy. You can't just walk in there and like after one day you have this like big, amazing booty, right? So it's kind of mostly, you know, a patient who's preferably they don't have any kind of, you know, autoimmune diseases. You can't have any coagulopathies. You can't have any kind of bleeding disorders or anything like that. So the same type of candidate that would be for dermal filler, actually the exact same. But remember, we're putting in such large quantities. When we're talking about face, even when I do full facial balancing, my average like amount of syringes or ml is maybe like, you know, 8 to 10 or so that I'm doing for the face. Whereas when we're talking about booty, like we're starting at 100 mil.
Yeah.
So it's a very, very high quantity. So it's just setting expectations and making sure that they understand when we go through their informed consent, when we go through all the risks and complications. And I do see them every, you know, for a post treatment in 2 weeks, I see them 6 months, and I see them 1 year.
Wow.
So I do a lot of follow-up. I follow them very closely. I make sure that everything, you know, settles properly, that, you know, it's all in the right plane. It wasn't too superficial. We're not getting any like lumps and bumps that are unwanted. So these are all things that sometimes they come up, you know, after. It's not instant, right? You're going to see that in a couple of weeks, or you might see that in a couple of months, but at least I'm on top of it and I can address it right away. So the results are essentially perfect.
I love that. You remind me of a surgeon. Like you are doing
that next level.
You are doing that next level.
But you want people to be happy. And like, that's why I have perfect 5-star Google reviews. I have people who, you know, they were horrified to do this and they've been thinking about it for years. And, you know, I was lucky enough for them to come to me and they entrust me with their body. So of course, like if I was to go somewhere, I would want that level of care too. So that's why I pride myself in making sure that I'm at that same level.
Beautiful. And in terms of the other treatment that I'm very curious about, AEROLASE.
Yes.
I've seen the before and afters are magnificent. I want to do it, and I'm afraid of a lot of treatments.
This one is, there's nothing to be afraid of. So it's a 1064 Nd:YAG, which is safe for all Fitzpatrick skin color. The biggest difference is that it's a 650 microsecond pulse. So we're not talking milliseconds or seconds, we're talking microseconds.
That's fast.
So by the time it goes in, hits the dermis and comes out, it like you're already on to the next one.
Wow.
So when we're doing these passes, because it's delivering this energy so fast and so efficiently, we don't have the traditional heat that's usually harbored under the skin, which is the main reason why you can't get laser in the summer. You can literally burn from the inside out. Where because this is in and out and there isn't any heat that's remaining, this is the only laser that's safe all year round.
Wow.
So I can still do a full protocol and treat someone for their melasma, for their, you know, post-inflammatory hyperpigmentation, for their rosacea, which is so difficult to treat. I do acne scarring. But my most, you know, common patient is someone who wants skin tightening, because it's hitting 3 different things. So when it's going in there, it's targeting water, which is, again, that's going to stimulate for all your collagen, your fibroblasts, your elastin, all those types of things. It's targeting hemoglobin. So it's hitting anything that's like a blood vessel that has your red blood cells. So rosacea, we have all these like extra capillaries, we have tons of blood vessels, and that's why you see that red in the flushing. So because it's targeting right there, that's why you see a massive reduction in all of these really stubborn telangiectasias on the corner of the nose. You see a lot of these superficial capillaries, and these people suffer because it's a chronic condition, and it's amplified by certain triggers, right? So I had a very young patient, and she's like, I hate going out with my friends because I'll drink and all of a sudden my face is red as a tomato and I get made fun of. And this has been like, it's chronic. She's had it her whole life. And I originally started treating her doing microneedling. And it did help because she had a lot of superficial, scarring. And that was actually not even related to the rosacea. That was from like chickenpox. So it did help to bring that down, but it wasn't doing anything for the redness and the flushing. As soon as I switched her over to AEROLASE, like her skin, I'm telling you, it's like airbrush. Like it is just amazing. She goes out now. She literally said last year was the first time she went out with her friends on New Year's and like didn't feel self-conscious.
That's so good.
Like, it's instilling this level of confidence for people where they're looking at themselves and they feel, empowered. Like they have this like, I don't care about how my skin looks because I am already knowing my skin looks great.
Yeah.
Right. And sometimes like there's people that are blessed and they already have beautiful, perfect skin. Right. But, some of us aren't that lucky. So it's just an amazing solution. You said you're scared because a lot of them, usually traditional lasers are pretty painful.
Yes.
There's a lot of downtime involved usually. Definitely can't do it in the summer. So if you like to, go Miami and like go all these hot places, like good luck trying to stay on top of the protocol because it's a treatment plan at the end of the day. So let's say you wanted to do skin tightening with me, you're going to come in every 2 weeks. And imagine, you're going on vacation or, summer is coming, like that's going to affect your results. If we're doing, traditional lasers, even the full ablative lasers, you can't really be exposed to sun because like I told you, you can literally burn. So this just mitigates that entire risk. It completely gets rid of it to the point where you can go in the sun, you can go on vacation, you can stay on top of your treatment plan. So then you get these amazing results because you've actually done the full protocol. So it isn't a one and done as much as you do see a lot of results immediately. The minimum sessions are usually anywhere from 4 to 6. But you see those changes usually about session 3 or so, because again, that's how long it takes for collagen to be inducted. You'll be able to see that tightening effect. You see a lot of refining around the eyes. I can actually hit, or you can feel your orbital bone. I can actually hit all that whole area too. So a lot of women complain about, the droopy eye area, or like they feel like they have a lot loose skin here. Maybe they don't want to go do a blepharoplasty and they just want to tighten up, right? So this is beautiful because I can still get in there. They do have eye protective wear, but I can still lift the skin and I can get tightening around the eyes. And and my biggest issue, because again, I found this machine in Miami. I was actually at AMWC, which is a really huge, the Anti-Aging Aesthetics Medical World Congress. That was my first one I ever went to. And I remember them, like they had this beautiful booth and I'm like, oh my God, this laser looks like awesome. Like what? But the thing that shocked me was that they had pictures of everyone, every skin color. And I'm like, you don't usually see that at all. Right. So I'm like, what's the difference between this one? And they're like, yeah, because it's non-ablative, because it's on that such a high safety profile, like we've never burned anyone. They have 0 incident reports of an adverse event.
Wow.
Which you don't hear of that for anything. So I was blown away. They're like, do you want to be a model? I'm like, hell yeah. So I got the treatment done. And I had an event that night and I'm like, oh my God, my face is going to look crazy. Like, I don't know if I don't know what to expect, right? It looked like I did nothing. Like I just held it, like felt tight, but it didn't look like I wasn't red. I didn't like feel like anything was like too dry, which I mean, I've done lots of other types of lasers, which even some of them that I wasn't even indicated as a Fitzpatrick 5. There's no way I did like a CO2. I've done the halo. I've done lots of things that were actually made my hyperpigmentation worse. And, you know, I was at the point where I have eczema. So it's a chronic condition. It's like, I'll have dry patches, like random areas in my face, but, you know, at nighttime I'll start scratching it.
Oh my
So
God.
that, you know, I'll have all these like darker areas because of the inflammation, right? And then because I'm just prone to more of my melanated cells to go to those areas. So unless you have dark skin, like it's hard to explain, because it's such a, you get scared to even get like a pimple or like a mosquito bite. And so like imagine like having all this unevenness, and I struggled with that my whole life, you know? So I was committed to trying this laser, doing the whole thing, because they set my expectations that you'll see improvement, but you need to do 5. So I came back here. One of my good friends in Etobicoke, she already had the laser. So I'm like, I'm going to pay you. I want you to do like, treat me as a client, like just do your regular protocol on me. And I want to see if this thing works. And it was like, I'd say about 95% cleared by the 4th session. She has me on her website. Like she has me like as their before and afters, because it was just shocking how much it really helped to lift the hyperpigmentation.
Wow.
Biggest problem, especially for any Caribbean or like mixed ethnicities, we have these like dark circles, and
That's
it
what I have
sucks.
too.
Oh, it sucks.
Yeah.
So like I'm like, I hate having to wear so much makeup. Like I just don't want to have the concealer, and like that was the biggest thing. And then I'm like, oh my God, like it's brightening. And like, I'm not even really having to color correct. I'm not having to wear as much. I'm like, this is amazing. So like just that feeling alone, like that confidence and that self-esteem, like it changed the way, you know, I present myself and the way I carry myself, because I didn't feel like I was so conscious about, you know, unevenness that I guarantee, like, you know, it's like when you notice it, like you're the one that's probably like so hyper focused.
I know.
Normally people aren't going to be like, oh my God, you have this like dark spot. Like nobody actually does that, but you know, we're all our own worst critic, right?
Especially in this field.
Yes. Yeah. In this field, everyone, you know, has to look a certain way. Like we're in aesthetics, we got to look good. So it was just remarkable. And I did my due diligence. I did my research. I waited a long time before I invested in a medical grade equipment, period. Because again, like as we start out as injectors, you don't really think to like, you know, go and buy a laser device. Like you do eventually, because all these companies like attack us.
You.
But you know, I wasn't ever thinking I'm going to go spend that kind of money and like get a laser, because I just wasn't convinced.
Yeah.
There wasn't anything that I was like, you know what? I used this on myself and I saw amazing results on myself. Therefore, I feel confident offering it to my patients. There wasn't anything that like made me do that until I got that laser. And thank God I did, because I've transformed so many people's lives. I've made such huge progress with, you know, even anyone who walks in, like they're a candidate. So, you know, there's no discrimination either. Like, you know, there'd be certain lasers that I was interested in or treatments, and they're like, you can't because of your FITS 5. Like we'll burn you, you know? And it's just like, oh, like, but I wanted that type of result, you know? So I'm able to achieve those types of ablative laser results without actually even taking off the superficial layer of my skin. And it's working from the inside out, right? And the other thing too is it does target like melanin and melanocytes. That was the third thing that I missed. So it's the water, the hemoglobin, and melanin.
Yep.
So that's why it does all of those, you know, heavily, like the post-inflammatory hyperpigmentation. It even gets rid of moles, skin tags, all those types of things. There's a lot of medical indications, 36 indications.
Wow.
So, you know, toenail fungus, warts.
That's so
like,
random.
It does everything. It literally does everything. Like there's nothing that it doesn't do. It gets rid of hair. So whenever I'm doing a lot of patients' face, they're like, oh my God, I don't have like as thick of a mustache anymore. And I'm like, great. Like, that's great. You know, or like sideburns. A lot of women, they don't like their sideburns, or, you know, just everyone kind of has a couple, like some peach fuzz and like some of like maybe like a random chin hair or something, you know, but it's great because I get a lot of feedback that way. They're like, oh my God, I don't have to pluck as much. Or, you know, I don't have to worry about like getting like my upper lip wax, like all these little things that, you know, took time that, you know, maybe they were self-conscious about, but maybe they weren't as on top of. The lasers take care of that. Like it's taking care of it at the same time. It's doing it all at once.
How often do you need to do the laser?
So it depends on what the indication is. There's different packages and different protocols for the treatment sequence for each. Like I said, the most common one is the skin tightening, because everyone wants that really nice collagen induction. Some people, I you start them with AEROLASE, and then I also implement SCULPT. So, because SCULPT is in its own field of biostimulant, just chef's kiss. But this helps with like the overall face and neck, right? Because SCULPT, we're not really injecting in the neck. We're not really touching around the eyes at all, you know? So we're not going on the forehead, right? So there's areas that SCULPT can't get to that the AEROLASE can, and vice versa, right? So if I have someone who comes to me and they are really like wanting tightening, they do both. And of course, Botox, because we can't forget about Botox.
We can't live without it.
Yes, but that's the main thing that I'm seeing, and that's every 2 weeks. The protocol is 6 sessions.
Wow.
They come in every 2 weeks, and then they're done. So once they're done their 6 sessions, they come in once a year, and that's maintenance, right? Because we know every year we're losing collagen 2%, unfortunately. Moment we hit 40, we're down by 20%, girls. So we got to induce that collagen somehow. Which is why AEROLASE is just effortless. Like some girls, like they come in the beginning of their work day, you know, they come do a session with me, they put their full makeup on, they go to work.
Yeah.
You know, like there is no
put your makeup on after.
Right after.
Do you numb them for?
No numbing.
And is it painful?
Painless. It feels warm. Like it just feels like there's warmth happening. You feel like a little zap, like when it hits one of like the upper lip hairs, or like if it hits a hair follicle, you feel the zap and the heat going through the hair follicle, but it doesn't hurt. Like it's not unbearable. Like the most I would ever rate it on a pain scale, 10 being the worst pain I've ever experienced, is a 2 max.
I love it.
Like it doesn't, but I'm a baby, so like
That's
everything
amazing.
is like, everything for me is like, okay, I feel it. But like that was the other reason why I fell in love with it. Cause I'm like, oh my God, I can actually do this. And I'm not like, cause even microneedling, like, and remember I transitioned from using, like I had a lot of microneedling clients, and you know, you're taking the before pictures, you're cleaning their skin, you have to put numbing on, you're waiting for that numbing agent to kick in, which is anywhere from 20 to 30 minutes. Then you got to clean all of that off. Then you got to prep the skin, you got to put on the glide solution, then you got to get the microneedle ready, then you got to actually microneedle, then you got, like, there's just so many steps involved. Don't get me wrong, I love microneedling in combo therapy with AEROLASE. Amazing. But every single person that I was seeing for microneedling, they were like, this is doing the same thing without all those extra steps. Like I don't need to numb. I don't feel like I have to hide my face for the next couple of days because I'm not even red. And it's like painless, because microneedling, even with numbing, you still feel it. Yeah. Right. So, you know, and even the ablative lasers, those are pretty painful. Right. So the biggest thing is there's no pain, there's no downtime, safe for every Fitzpatrick, all skin types, doesn't matter if you have very sensitive skin. The biggest contraindication, of course, is if you have like hypersensitivity, autoimmune diseases. Let's say you have, you know, you're on a medication that creates photosensitivity. You can't be using this. Obviously, no pregnant patients.
Can you do it on the hands as well?
Everywhere, whole body.
Whole body. Beautiful.
I do a lot of the hands, the regeneration with Radiesse. So it's a package. You do AEROLASE first before everything, but every patient that I see now is just an easy thing that they can implement in their skincare and in their anti-aging routine, because it's just so simple to include.
Which do you prefer, SCULPT or Radiesse?
I like SCULPT because I think that for a long-term solution for your face and for the areas that we really notice a ton of either fat pads that are descending or just deflating. You know, a lot of us are losing volume because of GLP-1s and those types of things. Like I find that I can really target everywhere. And then any area that I feel like, okay, they still need a little bit more, which is usually like forehead and around the eyes, I can reach for dermal filler, or I can do Botox, or I can do laser. Radiesse is in its own category though, because it does what SCULPT doesn't do. Like it's creating like, it's a calcium hydroxyapatite, so it's mimicking bone. SCULPT is not doing that. It's just kind of flagging for all of your fibroblasts to go there and make more collagen, but it's not going to stabilize your cheeks. It's not going to stabilize your jawbone. And you can't put SCULPT in the neck, right? So I do a lot of neck rejuvenation too with the hyperdiluted Radiesse, and it's beautiful. Like it's beautiful results. Which there's not really much else that you can do on the neck.
Yeah,
you
your
can
neck
use
is
like
perfect.
I mean, I did it once already, but I'm due for another one.
You do AEROLASE a lot,
and
right?
AEROLASE a lot
like,
too.
It's insane.
Yeah, but the biggest thing is I had eczema on my neck all the time. And that's the other thing too. I don't get eczema anymore.
Oh, thankfully.
So I used to get like dry patches on my neck. I used to get a lot around my mouth, tons around my eyes, to the point that I wouldn't even be able to wear makeup because my eyes were like so dry and raw that they would crack if I put makeup on top of it. So because I've used the AEROLASE so frequently, and because I've stimulated all these new skin cells, all these new collagen, I don't have to deal with that anymore.
So good.
Which is just, that peace of mind is great. But again, usually when we deal with these chronic skin conditions, like, and from a derm perspective, because I worked at a dermatology clinic for years, we didn't have access to something like this. Like, I'm hoping that more derms get their hands on it, because it's just very inclusive. And I used to do a lot of like, burning off all the warts and all those types of things, right? I do like the electrocautery, or we would like freeze it off, right? And that hurt, and people would like dread coming to see me because I would come, I would do that, and I'm like, man, I wish I could just have offered them this, because like it's like a 1 2 3, 1 2 3, like it's just like a 3 pulse. We use a very, there's technically 4 lenses that we use. So if I'm using a lens for like warts, or like, let's say, moles or anything like that, or the toenail fungus or anything like that, we're using like a 2 millimeter lens. So it's very, very tiny, where it's coming out of such a small diameter, but it's so high powered, and it's so easy to use too. You don't even need to be a doctor or a nurse or anything. There's barbers that have this in their space. Like, yeah, because this is also gold standard for pseudofolliculitis barbae. So like whenever they usually African American men, where they have really, really hard to treat ingrown hairs, and then they keep going to the barber and they keep shaving and shaving and shaving and shaving, and it just keeps creating all of this folliculitis, because the hair follicle gets inflamed and infected. And then because it's affiliated with, pseudo barbae, that's why it's called that in the first place. It's affiliated with them continuously irritating that hair follicle and irritating the skin because of the infection. So the laser is killing all of it at once. It's removing the hair follicle because it permanently ablates the hair follicle. It's targeting the hyperpigmentation from that irritation that's even formed from that, pimple or whatever that's formed over top of that ingrown hair. Right. So it's targeting everything at once. And then those are usually like a FITS 5 or 6 skin color patient. So, it's and guys are babies. So like the fact that they, but it's like giving them these really nice like beard lineups,
amazing,
without having all the bumps, and like they don't feel as self-conscious, because it's like reducing the amount of hair on their beard, but it's also helping to improve their skin and the skin tone and texture. Usually there's a lot of these like just dots, and that's from the inflammation. We can get rid of that really safely too. So it is safe for guys. Guys are always scared of doing these types of stuff, but it's painless and it's easy. So that's why barbers have it. There's a lot of nail studios that have it too, because it gets rid of the onychomycosis. Like it's so well versed. It does everything.
I love that. I love it. And with that, so you also do a lot of injectables in the face. 8 to 10 syringes, even more. I remember even there was a post 12 to 15 syringes, I think. Who are the typical candidates? What's the age range for that kind of transformation?
I mean, definitely not younger patients, because they're usually coming for, the typical, they just want, their lips or maybe some jawline, some snatched look. I'd say like 30 plus, 35 plus or so. Those are the types of patients that they are starting to see that aging progress happen. They're seeing, they're losing kind of that, youthful volume that they used to have. A candidate who wants that instant result, because with SCULPT, it will still address those things, but it takes time. So they don't notice things until a minimum of like 4 to 12 weeks, right? So a patient who just doesn't want to wait that long, but they want to see instant results. And I learned all those techniques from Dr. Doan. She's fantastic. She's out in Atlanta, and she only does facial balancing. So she only sees clients who agree to her full treatment plan, which is usually addressing all these areas that people don't even talk about. And it goes based on a very clinical way of diagnosing what you are needing, right? So you don't see people who come in that are like, I want my temples done.
Yeah, they never say that.
Nobody says that, right? But she makes it so easy to position yourself. So you are the expert. You are the one telling them based on these criteria that if you fit all 5, then that means that you it's a temple crisis. She even uses the word crisis, which made me laugh. I'm like, that makes sense, because like you have to address this. And if you don't address it now, these are the steps for like the consequence if you don't address it now. Because if you start to doing, let's say you do your temples next year, therefore there's going to be more adipose cell, like this atrophy here. You'll notice that you won't have that fullness, like there's going to be more sinking. There's so many, the consequence is due to aging. We can't stop aging. So she just helps you tell your patient in a way that it's very easy to understand that you don't need to do it now. This is the cost of us putting, 1 or 2 syringes in there. We don't price per syringe either. It's based on area, right? And it's based on how much I clinically need in order to get the result that I'm looking for, which is taking you from having, full sinking in of your temples to, inflating it. And so you create that nice curvature and that nice OG curve in your face again, that you once had when you were younger, right? So like we have parameters that we're following, right? So it's not really necessarily saying, oh, you need 10 syringes. Like it's almost better to not even mention how many you're going to use. You're just going based on doing a full clinical assessment in all these different areas. And people appreciate that, because you're not saying like, oh my God, you need this desperately. You're telling them why. So when we learn medicine, we go based on what our client, like our patient is coming to, and they're saying, I have a cough, I have a runny nose, I have a fever. What's my diagnosis, right? So we create a diagnosis based on their presenting, their chief complaint and their symptoms, right? So we're trying to, I love the way that she's goes into the details of facial balancing, because you're doing it the exact same way from a health professional standpoint. You're telling them, if you don't address these symptoms, which widening of the forehead, there's the lateral brow drop off, there's also a drop off at the temporal fusion line, an enlargement of the temporal fusion line. Like these are very specific anatomical changes that you're seeing because of the deflation of the temple zone, right? So if we're telling them, like, based on my diagnosis and me actually showing you with a mirror in your hand, these are the things that I'm finding just by looking at you, right? It's clinical.
Yeah.
I'm telling you, I'm not making it up.
Yeah.
I'm not telling you, you know what, I think you need it because you got a little bit of volume loss. Like, what does a little bit of volume loss mean? What does that mean, right? Like, I don't know what that means. How is the patient going to know what that means, right? Exactly. So it's just amazing, because you can really show them and tell them, based on my findings, we have to treat the temple so we can go back to your, hopefully to your original contour. This is the cost for treating the area. This is the cost if we don't treat it today.
Yep.
Right?
That's well said.
Because it's probably going to double in price, because I'm going to need more product to get that same result.
Exactly.
Right? So when you explain it in that sense, and then you show the before and afters of your work, and you just stay consistent, people come to you because they respect the fact that you are seeing things that, will help them go back in time, like they're going to see the reflection and be like, oh my God, like this was me from, when I was like she literally says, even when she does like mid and lateral cheek, she tells you, like, ask the patient how old they are now, right? So you already told me how old you are. So like 26, right? So let's say, okay, what we do today with your mid cheek and your lateral cheek will take you back to when you were 23. Who doesn't want that? Like, that sounds great. Yeah. I'm like, I want that. Like, so it's just the way of like positioning yourself and setting the standard, and then not negotiating based on a per syringe thing. I put a lot on my story yesterday about that, because this industry is getting super saturated with, companies and clinics that are popping up and all these med spas, and they're offering prices per syringe and per unit that are just unbelievable. You can't, if it's matching our cost, how are you able to even have that as a service?
I
right?
don't know. And that's when I question, what are they using?
The syringe ninja. It's
Syringe
just two words
ninja.
together. But
Syringe
I got
ninja.
it from, do you follow Needle Daddy?
I do.
Chad?
I almost met him. Should I meet him?
He's dope.
Because he's in Fort Lauderdale.
He's hilarious.
So can we go?
Yes.
Did you meet him?
Yes.
Okay,
that's
so
where this came from.
We have to go.
So he had a post, and when I met him in person, I was like, this resonated with me so much, because he's like, how do I explain what I do? He's like, I take a syringe and I use it with so much precision and so much control and so much intention. I feel like I'm like using it as a weapon, like a ninja. And then he's like,
game over.
Yeah. And then he's like, if you will, a syringe ninja, a syrinja. And I was like, oh my God, when I saw it on it was like one of his posts. And then I remember I'm like, oh my God, that is like such a cool name and something that resonated with me. And when I met him at Aesthetic Next, I went to the conference in Texas a couple years ago. I'm like, look, I love what you said. And it was just like kind of like a little biography of like his experience being an aesthetic provider. And I'm like, I love his work. He's fantastic. He's a very, very skilled injector. And I'm like, something about what you said, like it's like what I do. I'm like, are you cool if I use it? He's like, babe, do it. Like, he was so down. He's like, definitely use it. He's like, it suits you better anyways.
Did you see I was with Diana, Infinite Med Spa in Fort Lauderdale?
Yes.
You are so passionate about this. It's so clear. Can you tell us your road to get here?
Oh, where do you want to start?
From the very beginning.
From the beginning? Okay.
High school.
High school. Oh my gosh. Okay. Well, I was actually going to start before that, because that's kind of where this whole me being so passionate about skin and all these different skin conditions started with. I grew up in a very small city outside of Toronto, like Kitchener-Waterloo. I don't even know if you've heard of it.
Of course I have.
Okay. But most people, like when I went away for school, like in the Caribbean and in the States, I was just like, I'm from Toronto.
Yeah.
Like I wouldn't tell people like I'm actually from there, because nobody knew where it was. They're like, I don't know. So, but in elementary school, I was the only person of color.
Wow.
There was no one else. Like, it was just me. There was one other Asian guy, which we were like cool. We were BFFs. There was one other Spanish guy, and that was it. But they weren't like my skin color. Everyone was not looking like me. So at a very young age, I was very confused and put in this position where there was an expectation to look like my, neighbor and my schoolmates, and I just didn't. Right.
Wow.
So it was very, as a very young person, I realized pretty fast I couldn't change it. I couldn't, do anything about it. I got made fun of a lot. I had no idea that, it was something that eventually, if you told me now, at the younger Sabrina, that this would be where I was, I would be like, wow. Because at that point, I felt really defeated. I had nobody to, really relate to, just my family members, and my mom's Guyanese. So she's much lighter than me too. Right. And I couldn't understand why I was this color. Like I literally was like, didn't know why,
Wow.
And it was one of those things where I'll never forget, because there was that one kid who was just making fun of me all the time. And he was just like, look, if you, stop eating chocolate cake, you might start getting like whiter. And I swear to God, to this day, it was just like, I believed him. I truly believed him. I remember like running home from school and like raiding my pantry and like throwing out anything, those like Betty Crocker like mixes, like cake mixes, and like, not even that I was like some like cake fiend or something, but I was like, so
nothing with dark pigments.
Yeah, because I was thinking, he told me that was why I was like this skin color. But again, like, we're kids, we don't know any better. And like, but I never looked at it as something that I would never felt included. I didn't know that, like, I thought that there was something that I did wrong. I had no idea, right? And it was also, I had eczema too. And like, I had that at a very young age. Usually we have that triad of asthma, eczema, and like a seasonal allergy or hay fever. I have all those things, right? So I was hospitalized when I was younger because I had that, like, tons of severe asthma attacks, right?
Oh my God.
And then same thing with the allergies. Like, everything made me, go into this spiral of having these asthma attacks, or I would get sick very often because, it would just trigger all of that. And then my immune system wasn't able to keep up. Right. So I was actually in McMaster for months. I had a whole lung collapse. I was on tons of steroids, my weight changed, and then I didn't choose to identify myself as that. I ended up deciding I wanted to go into sports. So thankfully my parents were amazing. They helped me, enroll. I was in everything. I was in basketball. I was in soccer. I was in hockey. And hockey was another thing too, because they're like, oh, like you don't fit in here. And I'm like, okay, well, I'm going to play it anyways.
Yeah.
And like, thank God I did, because then that helped me grow out of my asthma. Right. So honestly, the only thing I suffer from now is allergies, which I feel like we all struggle with that too. Yeah. But, it was very young age. I had to like learn discipline. I had to learn resilience. I had to learn how to rebuild. Like I had to not conform to all of these societal expectations. Like I just did my own thing, and then so same thing in high school. I was pretty popular. That high school was the first time I met other people that looked like me, which is crazy.
That's good.
But yeah, it was good. Thank God, right? And then, so it was, and then it started to be cool to be like, tanned all year round, like it was cool. And I'm like, oh, like I just thought it wasn't cool for so long. I had no idea, right? So I started to really like embrace myself, embrace my looks, embrace my appearance. And then, when I graduated from high school, I went to Wilfrid Laurier University. I wanted to do art, actually. I was obsessed with painting and drawing. And I think it's really interesting because what I do now is very artistic, but in a very medical way, right? Yep. So it's cool because I still was able to, do what I was very, very passionate about, which was art. My parents were like, nope, you're doing the traditional, like, you're going to be a doctor. Like, I'm sorry. Like, so I did the whole like undergrad. I did my undergrad in biology honors. I have a minor in chemistry. Wow. And after that, I was kind of like, I don't know what I really like. I want to do medicine, but I don't know, if I want to do it here. I don't know. I kept having a bunch of my colleagues that went abroad, and I've never been on a plane. I never left like Canada at all. I didn't even have a passport. I had to go and get all of that, right?
Oh my God.
And then, one of my friends, he was down there and he's like, you need to come down here and it's an amazing experience. Like you can fast track the whole program. You can write your licensing exams and like it'll be like a different change of scenery. Like you don't have to be in Canada. And I'm like, you know what? That sounds pretty cool. So I literally like out of nowhere, like out of the blue, just like packed up my whole life and moved to Anguilla, which most people don't even know where it is.
It's a beautiful island.
Beautiful island. So that was actually, it's like right off the coast of like St. Martin and like St. Kitts.
That's what I remember.
Beautiful. So stunning. But again, I was petrified. I'm like, I didn't even know like the requirements for airlines. Like I had like a whole giant bottle, like all these different drinks in my purse. Like, you know what I mean? Like I didn't even know what I needed to do to fly. I flew by myself. And I remember like getting off the plane and then they're like, you have to go take this ferry to get to where you need to go. I'm like, oh God, like I can't swim. I'm like, what am I going to do? So it was just interesting because I did all of that and I have no regrets. It was a fantastic experience. I got to learn a whole different culture. It's very third world. It's nothing like Canada over there. They didn't even have a McDonald's.
Wow.
So just a very big culture shock, completely different than here. Really early on though, I had a bad turn for the worse. Within a couple months, I was in a severe car accident. So it kind of cut my last month of the first semester. And it was bad. Like it was to the point that I had severe damage to both my legs. I broke my left ankle. I broke about 3 different bones on the other foot, shattered my jaw.
Oh my God.
Yeah, so it was bad. And those types of countries, they don't have the type of healthcare that we have here. I had to get air ambulance back to Hamilton, McMaster. So that was like, I was all excited starting my journey, like, I'm going to be a doctor. And then that happened. So it was pretty intense. I had, a lot of people tell me don't go back because, it's you just do the rest here kind of thing, and my family was very adamant. Like they didn't want me to go back there. And I'm like, like accidents happen, like things happen. It wasn't like anything that was, nefarious or anything. It was just like the road itself, all the roads are very like just gravel.
Yeah.
It was dark. It was nighttime. I went to turn and the car just didn't turn. Like that's just literally what happened. It wasn't anything like, crazy, you know,
Oh
whereas
my
here, like
God.
I've been in worse like fender benders here, and like the results weren't like that because the car just didn't have any airbags. It was like an old car, right? So you know, my fault, but again, like there wasn't much I could do. There was two of my friends that actually came to visit me from Toronto that were in the car with me. So it was just I had the worst of the injuries, and my friend that was in the car is the opposite side. So like the European cars, you know, when you're driving on the left side of the vehicle. So
It's different.
I think and then you're also driving on the opposite side of the road. So us going, you know, this direction, we're actually on the left side of the road instead of we're here, we're on the right side, right? So it was almost like my reaction to turn was the opposite, right?
Yeah.
So I just didn't have enough time to turn between like where the car was and like where we actually hit. So super unfortunate, but again, I didn't let that stop me. So I went back within 3 months. I finished all my physiotherapy. I was like off of all pain medications within a month.
Wow.
My jaw was wired shut for about 6 weeks. I was like, everybody kept sending me the Through the Wire, the Kanye song, and I was like, I don't get it. And then I watched the video. I'm like, oh, he's like literally rapping like with the whole same setup that I got.
Oh
it was
my
crazy.
God.
But yeah, I went back and I finished. So
Beautiful.
you know, I did.
Congratulations.
Yeah, it
Job.
was tough, but at least I was close to the same, you know, all my classmates that I started with. I was just one semester behind them, so like it was pretty cool. I still was able to maintain a lot of my friendships, a lot of my relationships. And then after all of our rotations were in the States. So I lived in the States for several years. I was in Chicago, I was in New York, I was in Miami. And that was just amazing because I got to learn from so many like expert doctors, amazing nurses. Like the healthcare system down there, yes, it is quite different than here, but just like top tier. Like it was amazing. I originally thought I was going to be an anesthesiologist. And I fell in love with that too. And I really love surgery, which is probably why I'm, you know, doing these non-surgical like augmentations. But yeah, it was just like the things that I had planned. And anytime I tried to control things, the outcomes never ended up being what I wanted. So I learned pretty fast that like I just had to go with the flow and just try my hardest and, you know, just not settle for less and not let people think that I can't rebuild myself and I'm not worthy of doing it. That was the other thing too, was, you know, my parents were from different countries. Like they weren't from Canada. So they kind of built everything themselves. They had nothing, right? So they taught me to just keep going and like no matter what comes up, because we always have ups and downs in life, and like to just stay focused and set that intention that, you know, you'll get to that goal, right? And it's very easy to lose track of that. Like we have such high levels of depression, anxiety, and all these mental health things that are happening. And not saying that I was immune to any of that. It was definitely challenge, like a huge challenge. But, you know, anytime I get you know, a time in my life where it's hard, I just think back of all these other things that I've achieved and I've rebuilt. And I was able to just, again, rebuild myself and rebrand myself or do whatever I need to do, reinvent myself. I don't care what it takes. I do it.
Yeah.
And, you know, it's been great so far. And, you know, I've applied that same ethic to how I work and how I, you know, take care of patients and how I do my treatments. And it's always like top level because I don't want people to feel like they're getting ripped off or feel like, you know, they're investing in their body or their face and they don't get the best results they possibly can get, right? I have amazing colleagues that are like super talented injectors and like amazing nurses and doctors and IMGs, and like, you know, I don't look at people as competition either. I think it's really important that we all help each other.
We should.
And we have a safe community, and, you know, we're able to talk to each other and you know, talk about patients and talk about, you know, complications. And, you know, I can tell you my experiences, you tell me yours. And hopefully that'll help me with my next clinical judgment when I have, you know, a similar situation. Like we should all be able to do that without feeling like we're taking away or like we're giving too much, which is a standard that I think with a lot of great people in our industry that they're starting to really implement.
Yes.
Kimsey is a great example, and like how she's doing all of her things with nurses and needles.
People about.
Yeah.
I'm like, I'm not a doctor. I'm a nurse. I need to have somebody overseeing this. It's not just the product.
Yeah. And again, like people don't know. And it's one of those things that we have to educate everybody. But at the same time, it's like it's so oversaturated with this idea that injectables and aesthetics should be cheap and it should be discounted, and it shouldn't ever be discounted.
Yeah.
Because there's so much aspect, but the biggest aspect is the safety and
Yep.
the protocols that we have in place, even the things that we have in our fridge to control the complication and to start this whole entire like emergency protocol. We have to have hyaluronidase, we have to have like warm compresses, we have to have EpiPens, we have to have systemic vasodilators, we have to have so many things on site. God forbid that there was a vascular occlusion, or if there was some type of complication, we have to be prepared.
Yep.
Right. And as nurses, like in the OR or in emergency departments, or just period, like we're trained to handle complications like that. But when you transition into aesthetics, it's almost like it's so glamorized and it's so conventional now that people forget that it's still a medical procedure.
I know.
And there still needs to be so many things that are happening in the background that these patients aren't aware of, that we have set in place to decrease these risks of all of these possible complications. But regardless, we still have to be able to handle them. Yep. And we're trained to handle them, which is why I go to so many trainings. I go to so many advanced trainings. I go to tons of complication trainings. I love Dr. Tim Pierce. He's the best. I actually met him when I was in Switzerland for the Inner Circle.
Wow.
And that was like one of the best conferences. But there was an entire day of just complication management, a whole day, and like, again, like it's not just from going to school. Like we still have to continuously learn. We still have to get ALS and BLS certified for first aid. We still need to know all these CPR skills. Like these are all things that like we constantly have to be refreshed and we have to be recertified for. It's not just, you can't just wing it.
Yeah.
Because you're responsible at the end of the day. So again, it's just one of those things where as much as people enjoy the lower pricing, they're paying for it in a way that is not worth it, because they're paying for it in safety. You're exchanging a cost for your safety, because there's no way you can offer that level of safety as a medical provider or as a space where you're offering these treatments and also discount it to the point that it's below cost.
Yeah.
It just doesn't work together, unfortunately.
And then you can't sleep at night.
Yeah.
And for an injector, what I noticed, my clients like when I'm refreshed.
Yeah,
when I'm
of
not
course.
tired.
And you're not like full of anxiety because you're thinking about that nose that you did yesterday, but even if you did have a complication, like you probably, like regardless, it sucks whenever we have any complications in this industry, but thankfully we have more support systems and like we can talk to each other about it. And it's not really something that you should be ashamed of. It should be something that you're asking all of your colleagues for. You're asking your medical director. You're staying on top of being, at that level so you can confidently, reverse these complications, right? Luckily, we use product that are mostly reversible, right? Unfortunately, our PLLAs and our CAHAs are not reversible, but those are things that, you have to be advanced to be offering that. I only got certified in SCULPT after I was injecting for about 2 years, right? So again, that was one of those things where, it took time for me to feel like, okay, I'm really, really good with just like using a needle, using a cannula. I'm very, very comfortable with all of my outcomes with hyaluronic acid gels and fillers. So now I'm ready to step into the semi-permanents, right? And you need to be like, I got trained by freaking Chino Bay. He's like the man,
That's insane.
And again, like he's the #1 sculpture provider in all of North America, right? And again, like learning from somebody like that, like he's seeing like 10, 20 people a day, just that alone. So there's so many different techniques that you can really embrace and you can be able to offer. But again, the risk bracket is much higher. It's not reversible. So if I do cause a nodule, or if I do have somebody who comes in and they got all these like, non-inflammatory lesions, let's say from radius, even when we hyperdilute it, there can still be these non-inflammatory, even inflammatory lesions that happen. And it could be like 4 or 5 weeks later. Right? Or even, God forbid, like a biofilm or something like cellulitis, or like all these types of things that can be a complication. You have to be able to manage those things. Right? And again, like, I don't think that a lot of these med spas and these places that are offering these services at such low rates, like, I don't think that if you call them and you have those types of complications, they don't even answer the phone.
Yeah.
I've had people come to me from going to those types of places with complications. I've had people, I remember vividly this girl about 2 years ago, she was like hysterically, I guess, going through the phone book, like calling people. Like, it was like an 8 a.m. phone call. Okay. I've never met her before. She's like, I'm not going to say where she went, but she went to this place, she paid barely anything. She got her lips done. She had this massive, like, hypersensitivity, like an angioedema situation happening. And I'm like, I would love to help you, but you really need to see the provider that you went to. Like, they are responsible for taking care of you. Nobody's answering. I can't get a hold of anybody. It's been like 2 days and I don't know what to do. And I'm like thinking VO, or I'm thinking like something bad, right? So I'm just like, I was trained by lots of, specialists, and the derm that I worked with for years, she's just like, you should never take on other people's work and other people's complications, because then that's liability that you're imposing on yourself, which I understand that from a legal perspective, but it's also like, I'm an empath. I'm a caregiver. I'm somebody who, I can't see someone struggling on the side of the street, or God forbid, a patient who's in need, and not do anything about it.
Yeah.
Right. So instead of what I was advised to do, I took her on. I saw her in clinic. It wasn't a VO, luckily, but it was a hypersensitivity reaction. So put her on some prednisone. She had a lot of antihistamines, all these types of things. It went down eventually. But again, like, I had to manage that. I didn't charge her for that. But she couldn't even get that from the place that she went to.
Horrible.
So I already know that it exists in this industry. I already know that there is a disconnect. And that's the biggest challenge that we face, because how do we shut that down? How do we stop people from, offering, syringes and doing people's lips for $100 for a syringe? And then, God forbid, something happens to them. They can't even connect to those providers because it's literally like stopped. Like, front desk won't even tell the injector because they just don't want to take it on. Like, they don't want anything to do with it because they work by volume. And when you work by volume, there's no space, and there's definitely no time to see clients who are coming in with these types of, like, lumps or bumps or a vascular occlusion or any of these things. Like, it's almost like they wash their hands and they don't want anything to do with it. And for me, like, I don't think it's something that should ever even be compromised. It shouldn't even be negotiable. Like, everyone should be trained, and everyone should take this so seriously. And the fact that, there's so many places operating and they don't take it seriously, like, it's not good. It's really not good.
I agree. We have to hold a certain standard. You're so right.
Yeah. And like, if we aren't taught to all rise to that standard and rise to that level, it's hard. It's very easy for places like that to keep operating.
Exactly.
Because they aren't getting scrutinized.
Exactly.
There's no CNO or CPSO or anybody on them to hold them accountable for neglect or for them just not taking care of their patients, because they don't look at them as patients. They just look at that person that's booked at 12 o'clock that's, buying $100 syringe. That's it. It's almost like they're buying a product, and it's like, you're not buying a product. You're buying a medical professional service. That's what you're buying.
That will last you, that will be holding your hand every step of the way.
Yeah. And me and Rack were talking about, like, imagine we put it into the perspective, because we do a lot of model calls, and we do like those types of things. So we do discount it, but again, it's just covering costs, but it's still in the $3,000 to $4,000, $5,000, up to $10,000 range. Right. And so we had a conversation about the fact that, like, imagine we put those, 100, 200, 300 ml quantities in the perspective of going down the street and getting your lips done. Right? Because you go down the street, you get your lips done. Usually they say, do you want half of a syringe? Do you want a full syringe? Whatever. Usually in Toronto and GTA, at least, they charge anywhere from $5 to, like, let's say, I've seen clinics charge even $1,000 for lips, right? So let's go with the lower end. Let's say $500 for 1 mil. And that's standard. That's just how much it costs to get your lips done. If you see anywhere cheaper than that, I would caution.
Yeah.
I would be a little worried. But if you go with that pricing, if we take $500 for 1 mil and we times that by 100, because that's how much we're putting in their booty.
Yeah.
They should be paying $500,000 for these services, which is ridiculous, but they're not paying that, right?
Yeah.
So I try to explain it to clients in that way, where I'm like, you're not even paying realistically the inflated price that we charge on a regular standard basis for 1 ml.
Yeah.
Right? We're only able to offer you this 100 mil. I charge about 6,800. That's covering my costs. That's covering my expertise. That's covering my time. That's covering my all of my supplies, my overhead, staff, everything. Right? And it actually makes sense for me because there's a profit involved. Whereas when there's a model, it's just only the cost. That's it. But the cost is still in the $3,000-$4,000 range, right? And only reasoning I'm getting it there is because I'm buying in such large quantities, and I'm so busy that I see so many people and I'm able to buy in bulk like that. Because if not, imagine just taking 100 of those little 1 ml syringes. Like, we would be losing our minds. That's insane. Right? Like, and it wouldn't even be practical, because imagine how long it would take to inject all of that, right? So again, like, it's just like you have to, like, the lack of understanding, and it's just we're not educating patients well enough because they don't understand that. They don't know. But now I've started to kind of like give them that perspective where I'm like, look, we aren't charging you the same standard, because if we were, you'd be paying $500,000 for this, which is hilarious. Yeah. And you're not paying $500,000. You're actually only paying $6,800 plus tax. How would you like to pay? You know, like it should be that simple, but it's not, you know? So the disconnect is just like, in reality, people don't understand that these products that we are injecting into them cost a lot of money because they are actual real products. We're not getting them off of Alibaba or freaking Amazon. Like, these are real products. They're Health Canada approved, which takes a lot of scrutiny to be Health Canada approved, FDA approved, and they're also like sterile, right? You can buy Botox like on Alibaba. You can buy it for like $100 or even cheaper than that. I've seen it for like $50 for a vial of like 100 units. Okay. But like, we don't know where it's manufactured. We don't know how it's manufactured. We don't even know like how to, you know, reconstitute it. We don't know. Like, and we have the option. Let's go buy something like that. And like, God forbid we were to inject that into somebody, right? Terrifying. Like, the reason why we buy it from these actual, you know, legitimate companies like, you know, Prolenium and like Allergan and Galderma, we're buying it straight from there because those are the people that are actually making the product, right? Like, it's the same as you going and buying a car. Like, would you go buy like an actual, you know, we're already saying G-Wagons, you're going to go buy a Mercedes, or you're going to go down the street to a guy who says, you know what, I can make a Mercedes for you. It's going to be half the price, but like, it's not a Mercedes, you know? It's just like, it's literally like the same thing. Like, exactly. We have to, you know, do we want the real thing or do we not? Right. Exactly. And if you want the real thing, it costs the real price. Yeah. You can't be expecting the price of the kit car for the cost of the actual real one. Exactly. And it's the same thing when we're talking about what product we're reaching for, and we have to buy those products. You can't come in and say you want Botox without us actually having Botox in stock, right? And it's not cheap. And again, like, it has to be even temperature sensitive. Like, we have to have it in a refrigerator. It has to be regulated. Like, it has to be within 2 to 8 degrees. Like, there's just so many little things involved. Just to offer it, period. Exactly. You know, just to say that you offer it, it costs so much money in training, so much money in just supply costs. And of course, like, you have to be able to know that where you're buying it from is legit, right?
Yes. And going back to what we discussed before filming also, your reputation, staying honest amongst the injectors in the field, what advice would you give to anyone starting out or anyone in the field?
Yeah, I think that the best advice, especially because I've gotten that from all the amazing mentors I've trained with worldwide, is just like, again, like, if you're brand new to this, like, how would you want your face injected? How would you want your treatment done? If you were to walk in somewhere and you wanted Botox, or if you wanted your lips done, or if you wanted, you know, non-surgical hip contour, how would you want that to play out? Would you want it to be a quick in and out, like you're just a number? Or would you want it to feel like it's a full treatment and you have a provider who cares, who is going to follow up with you, who is going to ensure that when it's being done, it's done in the most highest level of sterility, and that injector has trained, that they've done all their courses, they went around the world, they spent money to educate themselves, and they are so well versed in what you're paying them to do that you are that confident to just lay there and let them do it. Right? That what they're using and what they're injecting in you is legit, and you have every right, like a patient has every right to ask, show me the bottle, show me the syringe. Before it gets injected, more patients should be actually asking, and they don't.
I like to open it in front of them, especially on their first treatment.
Yes.
I'm like, I know it's your first time, let me just show you.
I do the same thing. But again, that's just showing transparency. You should be an open book to your patient. You should be able to show them exactly what you're doing. You should, in layman's terms, explain exactly what you're doing every time. Anytime, even putting topical numbing, I'm like, so now I'm going to apply it to your skin. Now I'm taking it off. Now I'm announcing everything that I do, every single step. These are things that, like, it's more work. And yes, it takes more energy, but that's what's going to set you to that level.
Exactly.
And that's what every medical professional should be operating at that level. It shouldn't just be an in and out thing. And yes, the only advantage to it being in and out like that is because, you get to see more people. Therefore, you make more money. But it shouldn't be about that. It shouldn't only be about that. Yes, I agree you need to make money because we have bills to pay, and we gotta put food on the table.
Expenses for the product, for the syringes, for the cannulas.
But like, you yourself also have expenses. Like, you have to live. Like, we have to feed ourselves. Like, we need to have shelter. So I understand it shouldn't just be like, you can't be hyper focused on how much money you're going to make per patient. Because remember, you are still responsible at the end of the day. So if you don't take that seriously and the patient's not taking it seriously, that's where you can get into trouble, right? Because, that same person who reached out to me, right? Now I'm liable for them. But again, she had no other choice.
And whenever they come with that kind of situation, I always ask, where did you go before and who injected you? And then I make a mental note in my mind. And if it's a pattern, it's just a mental note. Like, we know each other. It's not that I'm going to judge that person.
No.
But it's just, if it keeps happening, word may spread.
Exactly.
And then there goes the reputation.
And
here it's everything.
Like, that's all that matters. And it's just like I told you with the Google reviews. And now when I have, these master classes, which I'm having one on Sunday, which I'm so excited
for you.
But yeah, like when I'm training and I'm teaching they're not necessarily brand new nurses. A lot of them are very advanced. Some of them have even been injecting longer than me, but they want that specialty, learning the body contour, which is a very advanced type injectable service to offer. But even the models that are coming in for there, like, they know, like, I'm still treating them the same as if they were to come on a regular day. Like, we sit down, we go through their intake together, we go through their medical history, like, the consent form is signed. Like, I teach them to do the exact same thing, right? And they feel very confident after they do trainings with me, because again, like, if I'm telling everybody to do the same thing, my hope is that they're telling other colleagues and everyone else is doing the same thing, right? That's what I can hope for. I don't know if it's actually happening, but people will recognize, and you'll notice the testimonial and the feedback that you get from these people and the patients that you see. They're glowing reviews because they've been to those other places where they didn't get that type of treatment. Like, their consultation wasn't even like, they didn't even have a consultation most of the times.
Horrible.
So it's just setting yourself, like, you be aware that this exists, and these types of spaces and practitioners exist, but don't allow that to be your brand. Like, be your own self, and know that when you're authentic and when you are honest and when you are able to be fully transparent and just be like, this is exactly what you're getting done, this is exactly how I'm going to do it, you can reach out to me at any time. I leave the door open for my patients. I leave the door open for any of my trainees. Everybody, like, blow up my phone anytime. I don't care. Just as long as you're reaching out to me, and I can help you either feel at ease if you're dealing with a complication, or if it's a patient that's unsure of something, like, maybe they have a lump or a bump or something. Like, I don't want them to feel like they can't reach out to me.
And you're very responsive.
Yeah, right. I'm like, I'm on my phone all the time. Like
You're
when I'm
very
not with the patient,
responsive.
I got my
Yeah.
watch on. Like I can see
Yeah.
if like, see, my watch is talking to me now, but like I can
Mhm.
see if someone's messaging me, or I can see the urgency, and that's the key to making sure that you're on top of things.
Yep.
Because if it's not you, who else is it going to be?
Exactly.
Right.
They're going to go somewhere else. They're going to find someone else, and they're going to trust someone else.
Mm-hmm.
They're going to trauma bond
Yeah.
over you.
Exactly. And that's
Yeah.
like literally that one patient. That's exactly what happened with her.
Now she doesn't leave your office.
No, and she wouldn't let anyone else do her lips because of that. And I'm like, you know what? I never even offered to do anything. And it was actually a day I was supposed to go to a cottage. Like it was like a Sunday. Okay. Like I was like getting ready to leave. And then I told her, like, you know what? Come here, meet me here. I'll like evaluate and see what's going on. Right. Cause I'm like, you can only see so much in pictures. And like, yeah, that detoured my entire weekend, but it was worth it because at least like I put her at ease and her mind at ease. And when you go to an emergency department, they don't know anything about what we do. They don't know anything about aesthetics. They don't know what filler is. They don't know what hyaluronidase is.
They're like, why'd you put that inside?
Most of the times they don't even have hyaluronidase. So that's the other very important thing.
Or they don't know where to inject it.
Yeah. And like I tell any of in my course, in my Dream Curve course, I have an entire like section of like the protocol for buttocks augmentations and emergency complication response. So it's a whole page that they can actually rip out and stick on their wall, or whatever they want to use it for. But it's just like a step-by-step thing of like exactly what to do, and then when you're going to call EMS, when you're going to refer to your medical director, whatever you need to do. But like there's still steps that need to take place, right? And it's different than having a complication in the face. We've injected so much product, right? So like on deck, you have to have way more of the reversal agent than you normally would.
Yes.
Right? So, because again,
you probably have so much.
I have tons, but again, like I have that because I already know that if something was to happen, I'm well prepared because I have enough quantities of it to actually break apart those bonds and the enzymatic bonds that are in the hyaluronic acid itself. If I don't have that, then how am I supposed to, treat this complication, right? So I make it very, very like these are all within the course, and I explain to all of my trainees like this is more important than me even teaching you the technique. Like I'm sorry, the technique is great, and the technique is very from all the different experts that I've learned from, and then also like my own flair and my own branding as to like how I create these really, really nice lifted curves, right? So I go into technique in detail, but I think I go into more detail for complication. That's amazing. Because I think that that's just overlooked. And, I find when we know our anatomy and we are in our safe injection planes and we have mentors that are available to us, things are so much easier as an injector. And like we can do injectables in a very, very comfortable fashion. Because I went to Inner Circle and I did that training with Tim. Like if I have him on WhatsApp. So like I literally, and he's the main person where I'm like, if I had a complication, I can hit him up. He's in the UK. He might take a minute to reply to me, but like, he is literally the complication specialist like in the world.
He's so good. Wow.
He's fantastic. But just knowing that and having that peace of mind and like having that feeling that like, God forbid there was anything that I was like really stumped on or like something that like I couldn't figure out, I can message him. I have messaged him before where I'm just like, hey, like, I don't really know what's up with this patient, or like, can you tell me like
and
if
he
this
tells
is
you?
Yeah, and he's the best. So I'm just like that, just having that alone and that peace of mind, I'm like, I'm gonna make sure everyone has that same feeling. Major nerves and arteries are right along kind of like our femur and like going up into the pelvis. So if you start to angle like going up in this from the superior direction, you fall into that risk of getting it into all of those major arteries, even though they're so deep. It's just if your cannula is going in the same direction, there is risk of you getting into those arteries. Because
even with a cannula,
so yeah. And because remember, if we're dealing with a vessel that has a wider diameter than the cannula that you're using, of course it can get pierced. It's not as common, which is why we reached to cannulas in the first place. There's only one port of entry, and we can get to so many different aspects of one area versus poking with sharp needles everywhere.
Just a tiny little
like if you want somewhere, like if you want to use a sharp needle for precision and maybe there's just like one spot that I miss, sure, then maybe I'll use, but that's very, very rare. But again, like with the cannula, you can still cause those complications. So regardless, like you're never always 100,000% safe. Ultrasound guidance is fantastic too, because you can also watch and see where the vessels are, and you can see the cannula on the screen, and that's fantastic. I am implementing that soon as well.
Yay.
Because I think
that was all over Europe.
Yes, and everywhere. It's very common, and it's just to us, and as a business owner, yes, it is a higher level of operating in a safer way. So that's the main reason why I really want to bring it on. And that's also just setting yourself apart. Like, not that we're charging patients to treat safer, because you can't do that, but it just gives you a better peace of mind.
Exactly.
You know? So definitely going to be implementing that. So you'll see some booty injections with cannulas now.
That's insane.
Cannula and the ultrasound. And then we're also looking into more for learning the complications, more diversifying it from just learning for face, learning for more for body areas. I've even used like radius on the tummy and like tightening the tummy. You know, just different things. We use like lipolysis injections. Like we do those types of things too. So like our trending for aesthetics now is like going more into body and like doing more things for the body, right? So I definitely see that in the future. There's a really cool AI stuff that's coming out now that's going to really revolutionize like how we see a patient, how we treat a patient, and then there's more predictable outcomes.
I love it.
Right? So AI is inevitable. We're all going to have to embrace it, but I'm really trying to bring that on so it's like a full experience. I call it like the SCULPT experience, where like it's a full experience from start to finish, where you are, you know, you're having your full consultation, where we're checking for symmetry, we're measuring things, like we're busting out rulers, we have like metrics here.
Your girl for BBL, facial balancing, Sculptra, Radius, AEROLASE for skin, great skin, head to toe.